Assalamualaikum. In this video, I'll be teaching the third subtopic of stress. So we have looked at the first subtopic, which was cause of stress, and then we've looked at how to measure them. And now here in this topic, we will learn about how to manage stress. Now we're going to look at two main ways. The first method would be medical techniques, so basically using pills, drugs, and the second method would be using psychological technique. Okay, now I will look at medical technique first. Okay, now we all know that stress is often accompanied by depression and anxiety. So one way to treat them is by treating either depression or anxiety. So using antidepressants to treat depression, as well as anti-anxiety drugs to treat anxiety. Now, in terms of depression, drugs that are used to treat depression is called selective serotonin reuptake inhibitors, or SSRI. One easy way to remember this is mystery, okay, to treat your depression, or actually I might be causing depression, but here this is the drug that you would use to treat depression. Okay, one example of it is Prozac. Okay, so you all know about paracetamol. So paracetamol is the name of the drug, but there are different brands, Panadol, things like that. So it's the same here. The name of the drug is SSRI. One brand is called Prozac. Okay, now how does this work? By regulating serotonin levels in the brain to elevate mood. So basically this will also work on stress. Okay, another way is to treat anxiety. One drug that is used is called benzodiazepines. Okay, one popular product is Xanax. I'm sure you have heard it if you watch movies. Xanax. Okay, so basically how does it work? By releasing inhibitory neurotransmitters, meaning that the brain is less aroused, so the person is calmer and less anxious. Okay, now we can look at the effectiveness of benzodiazepines. One study that looked at it is called Khan et al. 1986, which used 250 participants, which were grouped in either benzodiazepines or placebo. Placebo is basically they thought it's a drug, but it's actually nothing. It has zero effect. Okay, so they were either given benzodiazepines or a placebo. After 8 weeks, the participants in benzodiazepines reported that they have reduced stress significantly more than this group. So benzodiazepine does work in terms of managing stress. So what we can do is we can evaluate on the effectiveness on benzodiazepines. We know that it's effective. However, there is side effects of benzodiazepines. Again, benzodiazepines is to treat anxiety. Okay, so these are some of the side effects of it. Okay, so what we can do is we can evaluate it in terms of that it's effective, but then there are side effects. Okay, so here are some of the problems. Long-term use of benzodiazepines can lead to physical and psychological dependency. Therefore, it should only be used for short periods. So there's a high chance that they can get too dependent on it or too addicted. Okay, so that's one of the problem of using benzodiazepine to manage stress. Again, it also has side effects, as I mentioned just now. Okay, side effects. It can also cause drowsiness and adversely affect memory. Again, another problem is the fact that these drugs treat the symptoms of stress but not the cause. So most stresses are psychological, therefore physical measures do not address the real cause of the problem. So in terms for drugs, all it can do is it just can reduce the symptoms of it, but it does not affect the cause. So it will just keep coming. Okay, the stress will always be there since the symptom is gone. Okay, so that's one of the problem when using biomedical technique. Okay, now looking at psychological technique, there's two ways: biofeedback and imagery. So I will look at biofeedback first. Okay, one way is using biofeedback, which is a cognitive behavioral technique. Okay, so basically you are attached using an EMG electrode. Okay, EMG, so it is attached to parts of your body, and then it will show on a screen what is your let's say heart rate, or your muscle tension. So you can, if you're stressed, you can see the numbers are high up in the screen, so you know that you're stressed. Okay, so here this person, knowing that he's stressed, will try to do relaxation, will try to do what are the ways, relaxation, meditation, deep breathing. Okay, and he will see immediately the effect. Okay, let's say deep breathing, so he can see his heart rate going slower. Okay, or if it's muscle tension, so if he meditates, he can see that the muscle is less tense after a while. So this is based on operant conditioning. Do you remember operant conditioning? This is where positive and rewards and punishment. So basically, he knows that he is stressed, so he does some behavior such as deep breathing, meditation, and he can see immediate reward. So the reward is, so he's less stressed, he is less tense, his heart rate is slowing down. Okay, so this is biofeedback. Okay, so from biofeedback, you can see your heart rate, blood pressure, muscle tension, and it immediately reports information back to him or her through the monitor. Okay, so not only that it is visual, there's also audio. Okay, so if you look at page 259 under principles of feedback, the patient has EMG electrodes attached to the skin surface of a particular muscle. So let's say if it's neck tension, so it is attached to the neck, because we know that when people are stressed, somehow their neck is a bit tense, or their head. Okay, so attached to the neck, so it measures the muscle tension, it measures heart rate and everything. Okay, so, but the subjects will also hear a tone with a pitch proportional to the EMG activity in a given muscle group. So basically, if it's tense, so there is a high pitch sound. Okay, high pitch sound. So when they do muscle relaxation, when they do deep breathing, when they do visualization, meditation, the sound, they will hear a low tone now, so which means it's less tense. Okay, not only that, the display here will be lower, they will also hear a lower tone, so which means they are relaxed now. As you see, as a patient gets better, they have to maintain a higher level of relaxation in the muscle to hear low tone, so that's their reward as well. Okay, now biofeedback has been used in stress management by helping people learn to relax specific muscle. It has also been employed to treat stress-related health problems, for example in reducing chronic muscle contraction headaches. Biofeedback is based on the principle of operant conditioning and receiving reinforcement for behavior that reduces the stress response. Now, most often, biofeedback helps people control their stress response by realizing when a stress response has been happening, and employing relaxation techniques like deep breathing, visualization, and meditation to calm their physiological arousal. So now, there's a study that tests the effectiveness of biofeedback, which is by Budzinski et al. 1969. Okay, so they had 15 participants, and they randomly allocated to 3 groups: feedback, low tone, silent. Okay, now in the study, it's people who have been reporting to have tension headaches. So tension headaches are associated with sustained contraction of the scalp and neck muscle, therefore relaxing the front tail muscle from the top of the skull to the forehead will have a positive impact on reducing the suffering of a patient. So these people are stressed, and they have been complaining about a tension headache. So if you look at your notes, page 260, the diagram, it's the frontalis muscle, top of skull to forehead. That's the part that is heavily affected. So again, they are attached. Electrodes are then attached to this part, and they are told to relax that part. Okay, now in the feedback group, participants were told that the pitch of the tone would vary with the level of muscle tension in the forehead. They were told to relax as deeply as possible to keep the tone low pitch. So in this group, they were told that if you're more tense, the pitch will be higher. Okay, they will hear a sound that is higher pitch. Okay, so they are told to relax as possible, as deeply as possible in their muscle at that part, the front tail, and to keep the tone low pitch. So the goal is to keep the audios lower, so to a lower tone. Okay, that's feedback. In the low tone group, participants were told to relax deeply, especially the forehead muscle. They were also told that the consonant tone should help them relax. So they are not told this part. Okay, they are not told this part. They only know that they were just told to relax deeply and were said that if the tone is constant, it should help them relax. Okay, so they do not know that if it's lower tone, it's lower level of muscle tension. They're only told that they should keep it to a low pitch. That's it, and they were told to relax deeply. Okay, in the silent group, participants were told to relax as deeply as possible and to do this in silence. Okay, so they were just told to relax as deeply. Okay, now, so results were collected over 5 sessions. Participants in this group feedback, knowing what low tone pitch means, okay, saw a significant reduction in the muscle tension over the course of the 5 sessions, and the reduction was rated in the 2 control groups. So which means this is basically what biofeedback is about, and it shows that this is successful in terms of treating tension. Okay, if you were to conclude, this study showed that the patient can be trained to voluntarily lower their muscle through the use of feedback. This study suggested operant conditioning techniques could be applied to a wide variety of physiological events in the body. The practical implication of this result would seem apparent. Biofeedback can have beneficial effects of profound muscle relaxation in alleviating a number of anxiety and stress related disorders. Okay, so that's biofeedback, basically using EMG, attach it, and then we'll have a look. You can have a look at your audio-visual display of your physiological activity, muscle tension, heart rate, and you do relaxation to try to keep it low. And here you can see immediate results. Okay, so the immediate reward of relaxing, of doing that activity. So from doing the activity, you can see your body is responding well. So you know you should keep doing it. Okay, that's biofeedback. Now, the second method is called imagery. You have heard this before, imagery, where in pain, one way to treat pain. Okay, so you can also use it to treat or to manage stress. So it is used to distract people from thinking about any stresses they have. It involves systematic practice of creating a detailed mental image of an attractive and peaceful setting or environment. Now, this method is usually guided. Okay, so creating a picture in the reader's mind by making the reader see, hear, taste, smell, or touch what is being described. So this method is usually guided. So basically, not everyone can do this effectively, so they need some guidance. So usually there are trainers. Okay, so if you look at your notes, page 260, there are steps. Okay, when you want to do imagery. So first, you should start by finding a private calm space and make yourself comfortable. Take a few slow and deep breaths to center your attention and calm yourself. Close your eyes. Imagine yourself in a beautiful location. Imagine yourself becoming calm and relaxed. Okay, so the step is in your notes. Okay, in page 260. So sometimes this needs guidance. You can't really do it by yourself. Okay, so there is guided imagery. Okay, it's called guided imagery. It has many uses. You can use it to promote relaxation, which can lower blood pressure and reduce other problems related to stress. You can also use it to help reach goals such as losing weight or quitting smoking, manage pain, and promote healing. Okay, so one study that tried to look at the effectiveness of imagery is Bridge et al. 1988, which used relaxation and imagery to reduce stress in 154 women with breast cancer in 3 different ways: control, or where they just do relaxation, or relaxation and imagery. Okay, so there are 3 groups: control, relaxation, and imagery. So they want to see which group can effectively reduce more stress. Is it this group, or relaxation only, or relaxation and imagery? If there was a hypothesis, it would be this group that would do it more successfully than the other. Okay. After 6 weeks, so this study was done in 6 weeks, measures of mood states were significantly less in the experimental group, which is this one, than in the control group, with relaxation imagery being particularly effective. So this is the main result. Okay. Now, what was the study about? Okay, to see whether stress could be alleviated in patients being treated for early breast cancer. It's a controlled randomized trial lasting 6 weeks. It's a natural study, outpatient radiotherapy department at teaching hospital. And this is the patient, 154 women, so you can already evaluate on the generalizability. Okay, so these are people with breast cancer stage 1 or stage 2. Okay, and 15 dropped out of the study before the end of the study. So what was the intervention? What happened in the study? So patients saw one of the 2 researchers once a week for 6 weeks. So they saw them for 6 times altogether, once a week for 6 weeks. In the control, they were encouraged to talk about themselves. Okay, to talk about stress and talk about themselves. In the relaxation group, it was taught concentration on individual muscle group. Okay, so they were told to relax, and they were told to usually they were told to concentrate on a particular muscle group. So let's say neck, and they are told to relax that part. Okay, they were told that part. In the third group, okay, they were told this relaxation, and they were also told to do imagery. So it was also taught to imagine peaceful scene of own choice to enhance relaxation. Relaxation plus imagery groups were given tape recording, repeating instructions, and told to practice at least 15 a day. So this is how they were guided. They were given tape recording with the instructions, particularly the instructions, the steps that are in your textbooks, page 260. Okay. So how did they measure? They completed Leeds General Scales measure, which gives the severity of depressive anxiety symptoms in patients who have not received a primary diagnosis. Okay, so they completed this before the study and after the 6 week, also after the study. So they did it both. So they compared the results before and after. They also completed a mood scale. The profile of mood states used 65 items to yield scores on subscales for attention, depression, vigor, fatigue, anger, and confusion. The women were fully aware of the experiment and were randomly allocated to one of the 3 conditions: relaxation plus imagery, or a control condition. Okay, and the main result is that after 6 weeks, total mood disturbance score was significantly less. So from the mood scales, okay, in terms of the Leeds General Scales measure, there was no difference between the groups, but you can see the difference in terms of mood scale. So it was significantly less in the intervention group, so relaxation plus imagery. However, women in the combined one, so relaxation plus imagery, was more relaxed than the relaxation only. So this group did better in terms of mood scales. Okay, significantly reduced. Okay. So that's managing stress using biofeedback and imagery. Now, we are also going to look at preventing stress. So before stress happens, we know how to prevent it. Okay, so this study, we're looking at Martin and Bob, okay, who used stress inoculation training. Okay, now it's a cognitive behavior therapy. Person can change way they think about certain stresses. Suggested client should develop a form of coping before the problem arises. Inoculate yourself against a disease of stress, like vaccination to prevent infectious disease. So basically, you know what are your stresses, so you try to cope, develop a form of coping before the stresses arises. Okay, so use clients' existing coping skills. Now, in terms of stress inoculation training, there are 3 steps. Okay, the first one is conceptualization. The trainer talks to the person about their stress experiences, such as how they would normally cope with stress. Negative thought patterns are identified. Okay, so that's conceptualization. And then there's skill acquisition. The person is educated about the physiological and cognitive aspect of stress and techniques used to manage stress, such as replacement of negative thought patterns with positive ones. So here they are trained to they are educated about the physiological and cognitive. So what are some of the techniques that you can use to manage stress? Okay, and then the third step is application and follow through. The application of the new skills through a series of progressively more threatening situations to prepare the person for real life situations. So basically, the 3 steps are: first educating yourself, and then you rehearse it, and then you apply it. Okay, so you educate, you rehearse, and you apply. Okay, now, so that's stress inoculation training. So basically, for people who are reported to be stressed often, so they are told to go for stress inoculation training. So before the next stresses arrive, so they talk about it, what causes them to stress, and they are educated on how to manage it, and then they apply it, what they have learned, and try to prevent stress. Okay, and then that's it. That's stress inoculation training. And so here we have looked at management of stress as well as prevention of stress. Thank you.